We're all going to die one day. Now, that may sound blunt, but that's a matter of fact, not opinion. We don't know where, we don't know how, we don't know when. All we know is that we will die one day. It may happen by accident, old age, or by illness, but since dying is such a personal issue, wouldn't you want some say in how you died, especially if it could save you from unavoidable pain and suffering? What if you made the decision rather than your body? Assisted suicide has been among debate for years. Some deem it murder. For others, it's mercy for the terminally ill. This past year, unfortunately, I had to watch one of my most loved people in my life pass away from cancer. His body transformed into an unrecognizable person. He was in and out of the hospital for intense pain, and ultimately he died of heart failure. In the aftermath, I often wondered, what if he could have saved himself all this pain? What if he had the option to die with dignity? Chances are we all have been affected by terminal illness. Whether we know somebody who is terminally ill or by chance it may happen to us one day. Wouldn't you want to have the ability to choose how you died? Today we will discuss the way assisted suicide can prevent a painful ending for terminally ill patients, the medical bills that can be prevented, and giving terminally ill patients a final decision over their body. Currently, terminally ill patients are not given the choice to determine when their quality of life has become unacceptable to them, and they no longer wish to endure their condition. They may be given as much comfort as possible through available medical means, but the patients still may consider their mental or physical state as unacceptable and unbearable to themselves with no remedy. One of the most common types of terminal illness is cancer. Cancer begins to break down the body and manifests internally. Healthline explains that the central nervous system controls emotions, thought patterns, and coordination. Chemotherapy drugs may cause problems with memory or make it difficult to concentrate or think clearly. This symptom sometimes is called chemo fog or chemo brain. According to Healthline, most people lose some bone mass as they age, but with chemo, some drugs increase this loss by causing calcium levels to drop. Cancer-related osteoporosis affects more women than men. Healthline also explains that hair loss is perhaps the most infamous side effect of chemo treatments. Many chemotherapy drugs affect hair follicles and can cause hair loss, also known as alopecia. Within a few weeks of the first treatment, hair loss can occur anywhere on the body from eyebrows and eyelashes to your legs. Many terminally ill patients experience some degree of depression, and it is not uncommon for it to be severe. Due to their conditions and symptoms, it is very easy for anyone to feel depressed for a variety of reasons that they have little control over. The National Center for Biotechnology Information explains that the medical literature suggests the frequency of major depression in terminally ill patients ranges from 25 to 77%. Depression is both associated with intense suffering and cause of intense suffering. All too often, physicians wait until the last weeks of the dying patient's life to decide to address the depression. By this point, it's generally too late. Advanced disease increases the likelihood of depression. The more symptoms of dying that patients are experiencing, such as nausea, bowel movements, bladder problems, and skin problems, the more likely they will feel depressed. As the patients are unable to manipulate the outside world, they become less and less interested in the outside world. Anxiety presents as agitation, insomnia, restlessness, sweating, tachycardia, hyperventilation, panic disorder, worry, or tension. And with depression, separating some physical symptoms from extreme anxiety from symptoms of the underlying disease is difficult at times. For the patient, knowing that they're going to die is one thing, but living through it is something that not all want to face. The physical pain combined with the mental pain could be enough reason for you want to end your life, even with the medical support offered. With anxiety being a major issue for terminally ill patients, A factor within that may be caused by the life they were leaving behind, specifically the medical bills left to their loved ones. We've all been to the doctor before, and have all seen the medical bills that follow. They can be outrageous, even from something as simple as a checkup. Now imagine having to be in the hospital full time with round-the-clock care. Imagine how expensive that could get. The cost for chemotherapy can vary as well, with some estimates as high as $30,000 over an 8-week period. The average cost for initial treatment is approximately $7,000. Radiation treatment can also have high costs because sophisticated equipment and machinery is used. Some estimates place the patient cost for radiation therapy at around $2,000 a month. Now, I don't know about you, but I don't have that kind of money lying around. In addition to conventional medical treatments, alternative therapies such as acupuncture, chiropractic care, and massage therapy may also provide relief. These therapies, which can relieve pain, fatigue, and other symptoms, may not be covered by health insurance. Some of the hidden costs may include the wages and loss from taking time off to travel and receive treatment. In some cases, patients are forced to tap into credit lines or use credit cards to cover the expenses and hidden costs. A caregiver may also be required to travel and assist with things related to care. According to Home Care Assist, 24/7 in-home care can cost anywhere from $3,300 to $5,700 a month. The cost of cancer or any terminal illness can be devastating on one's financial security. Many of us don't prepare for the worst case scenario. Once the patient knows that there is no treatment, it should be up to them how they want to proceed. With terminally ill patients, maybe weak, hazy, and unsure of what the future holds, it should still be up to them how their life ends. This not only makes them feel heard, but also like they have control over their body one last time. Mars Kramer experienced this situation with his wife, who was terminally ill. Eventually, for his wife, she made the decision to stop treatment because she knew that there was no point. He explains, after 7 years, the cancer suddenly turned aggressive and treatment no longer worked. It was just a matter of time, a couple of weeks or months maybe, before she would die from influenza or some other common infection. At the hospital, they gave her blood transfusion and told her to report next week. And they wanted to continue this treatment. If she had not fallen ill and refused further treatment, they would have no doubt continued in this way. She could make the decision of when she wanted her life to end. She didn't want a disease to claim her life, but rather have control over it herself. She wanted to die in a peaceful, painless way, surrounded by the ones that she loved. While many of us, I'm sure, would agree that if we had the choice of a painless death dictated at our own time, we would choose it. Death with Dignity and Aid in Dying advocacy groups argues that the term assisted suicide when discussing aid in dying is inaccurate. A patient must be terminally ill to access life-ending treatment, which means his or her life may already be ending, rendering suicide an inappropriate term because the patient is merely seeking to hasten the process. Dr. Robert Olvera is a physician in California whose 25-year-old daughter died after a 17-year battle with the disease. Olvera is lobbying state lawmakers in favor of assisted suicide. He recalls that his own daughter asked him twice to help her end her life. He explains, "There's some people that tell me, why are you doing this? You're supposed to cure. You're supposed to help this person." My answer to that is some people need help dying. To prolong a death in some cases is not helpful. It can be counterproductive. I'm helping people like my daughter, who need help at the end of their lives. In conclusion, assisted suicide should be made legal, giving terminally ill patients the right to end their lives in a peaceful, painless, merciless way. Assisted suicide can save patients for prolonged pain, mentally, physically, save on expenses, and give patients the ability to choose how their life ends. As I stated before, we are all going to die. If you were in this position, wouldn't you want to be able to make the decision of how your life ended? Thank you.